Minglaba and welcome to MI Radio's Myanmar Today. I'm Agajo. Today we have reports on unpredictable COVID-19 situation and how people celebrate Buddha's Day. And another story is on how strong is China's healthcare system and Yangon Regional Myanmar Rescue Organization taking responsibility for COVID-19 victim transport in most parts across the country. And the last report, which is on the Ministry of Labor, Immigration and Population, announcing 21 businesses resume operation in line with the health directives. All of that on this edition of Myanmar Today, but for now, let's take a look at what's happening in local news. The Coordination Committee of Ethnic Armed Organizations and the signatories of the nationwide ceasefire agreement held a coordination meeting at the National Reconciliation and Peace Center in Yangon yesterday to work together for prevention and containment of the COVID-19 disease. Vice Chairman of the Coordination Committee and retired Lieutenant General Kinzo U led the government side and Umyo Win and party represented NCA-SEAO. Regarding the meeting, Peace Commission's Advisory Board member Ula Mangshui said, quote, "The Vice Chairman of Committee explained the formation of this committee and invitation for coordination have been informed to the 18 ethnic armed groups. The 14 groups have reported their implementation. We will hold an online meeting in a couple of days with the 10 ethnic armed groups signed in the NCA. The COVID-19 must be faced against for the national interest, and the both signatories and non-signatories are expected to work together in this issue." More than 50,000 cloth masks will be freely distributed in 7 townships of Kayin State, according to an announcement by the Cloth Mask Campaign made in the temporary market of the Pa'ans Ward 3 yesterday morning. The youth volunteer organizations carrying out the campaign will be led by State Minister for Social Affairs Ubobo Wema. The campaign focuses on educating the public on the proper use of cloth masks and their importance in minimizing a person's expenses as they can wash and reuse compared to surgical masks that are discarded. The local social affairs minister and youth volunteers distributed 1,500 cloth masks to the vendors and customers at the temporary market yesterday. They demonstrated proper use of the cloth masks and its advantages. India donated medical supplies to aid the containment and treatment of COVID-19 in a ceremony at Yangon International Airport yesterday. The donation is organized by the Embassy of India in Myanmar. The special flight transporting the medical supplies from India landed at Yangon International Airport at 12:20 p.m. yesterday and was welcomed by officials from the Ministry of Health and Sports and Indian Embassy. Indian Ambassador Mr. Swarab Kumar handed over medical supplies to the Ministry of Health and Sports, and Director General Dr. Taton Chol from Union Minister Office of the MOHS received them. That's all with the local news. Now we will move on to our first report. The full moon day of Gasong, which is also called the Buddha's Day, falls on 6th of May. Buddhists in Myanmar are not able to celebrate this significant day on a grand scale as usual because it is time to coincide with the COVID-19 outbreak. At the same time, Yangon becomes alive more than it was in the early stage of the virus crisis. Thora Susan got the story about how Yangon is doing at present and how people around the country celebrate the Buddha's Day.
The third and fourth weeks of April were the period when the highest number of confirmed cases for COVID-19 was found in Myanmar. The rate of confirmed cases reached its peak on 14 April with the highest number of 22 cases found in a single day. This unpleasant situation made the city's roads and crowded places of the country remain completely silent. However, the situation is getting better from the last week of April to 5th May. Within 11 days till 5th May, total 17 cases were confirmed with a peak number of 6. With the time came to get back to work after the long holidays and another reason of decreasing rate of confirmed cases, more people are getting out on the roads of the cities. Yangon, with the most number of confirmed cases, becomes more alive with more people walking than the intense period of the virus crisis.
After 1 or 2 days after the homestay period of the Indian holidays, people did not go outside because they were quite afraid of the infection. But later, more people are in the town. Of course, they are aware of the virus, but they are going outside. This period of COVID-19 outbreak should be without traffic jam, but there are still many cars stuck in traffic jam at present. You can even see more buses running. This is because bus drivers, taxi drivers, and passengers are going outside to earn money.
Since the outbreak of COVID-19, Myanmar people had encountered to celebrate the most important celebrations in very different ways from usual. Thinton Festival and Myanmar New Year Day, which are usually celebrated on grand scale, just passed quietly this year. Another important day for Buddhists, who are the majority in Myanmar, falls on 6th May. This is the full moon day of Kaso, which is also called the Buddha's Day. Although the situation is quite in good status, the precautionary measures including the ban on gathering of more than 5 people and the closures of some public places are still in effect. So despite the fact that the cities became more alive, people are to celebrate the unusual full moon day of Kaso. It is actually an important day because the Buddha was born on the day of the full moon of the month of Kaso, upon which he attained enlightenment at the age of 35, and also upon which he entered Parinibbana, which means passed away, at the age of 80. Buddhists water the Bodhi trees as the significant celebration. This celebration is usually held on grand scale in Shwedagon Pagoda of Yangon, but the situation is now controversial because the pagoda is temporarily closed during the virus spread.
Usually, 84 voluntary groups of Shwedagon Pagoda, staff members of Pagoda Board of Trustees, and the guests together celebrate the full moon day of Kason by pouring water to the Bodhi trees at Shwedagon Pagoda. People wear the different costumes of Bima, Nadaja, Naga, Galo to pour 5 Bodhi trees. This year, there is no celebration and the pagoda is closed. However, the Buddha said that a person who lives usually not away from the Buddha but follows the Buddha's teachings is the one who is staying closely with the Buddha. So, on this full moon day of Kaso, I suggest the Buddhists not to focus on imperfect places and situations, but to do good deeds by remembering the teachings of the Buddha.
The Buddhists not only from the cities where the confirmed cases are found, but also from the areas with no confirmed cases have been found yet, are doing the same to celebrate the full moon day of Kaso. Living in Padang of Ayeyarwady region, where no confirmed cases have been found yet, Doyen San talk about how the residents are doing on the Buddha's Day.
Usually, people in our ward go to the monasteries to observe perceptions on full moon day of Kason. They also pour water to the Bodhi trees. But this year, because of the COVID-19 outbreak, we stay at home and observe the perceptions by learning the live Dhamma broadcasts on television. Some people go near Bodhi tree to pour water.
State Councillor Aung San Suu Kyi posted on her Facebook that it is grateful to hear people staying home and learning Dhamma. She also said Yangon becomes alive, but people need to still be aware of the health guidelines. She also suggested holding mask campaign to help people get the habit of wearing mask. The state councillor advised the citizens to endure this difficult time and to try together to get back to normal situation. That's the report by Dora Suisin from MI Radio.
That's the report on unpredictable COVID-19 situation and how people celebrate Buddha's Day. China witnessed a quick recovery from the impact of the COVID-19 pandemic since its outbreak onset. This quick rebound is brought about by the country's strong and systematic healthcare system. The report covers how strong China's healthcare system is and how medical workers in China commit in saving lives and combat COVID-19. China witnessed a quick recovery from the impact of the COVID-19 pandemic since its outbreak onset. This quick rebound is brought about by the country's strong and systematic healthcare system, along with the obedience of the Chinese citizens. China also takes the center stage in the race to seek the vaccine to fight the COVID-19. More than 80,000 medical workers have remained on duty during the 5-day May Day holiday season in Wuhan City, which is the region worst hit by the COVID-19 pandemic, while others are enjoying long-awaited outings as tourism attractions have gradually reopened to the public due to an eased epidemic situation in China. Mazaji Newin of China Media Group from CRI Myanmar Department said,
COVID-19 အခြေအနေကိုရင်ဆိုင်တဲ့နေရာမှာတရုတ်အစိုးရကဒီပြည်သူတွေရဲ့အသက်လုံခြုံရေးနဲ့ကျန်းမာရေးကိုအမြဲထိတ်ဆုံးနေရာမှာဦးစားပေးတဲ့နေရာမှာအမြဲထားတာတွေ့ရတယ်။ဒီကျန်းမာရေးစောင့်ရှောက်မှုစနစ်နဲ့လည်းစနစ်တရားလည်းဒီအားကောင်းတဲ့အပြင်ကိုစားပစ်ချင်းတုန်းကဒီယောဂဖြစ်ပွားတဲ့ဒေသတွေကိုဒီစေဝါဖြန့်ဖြူတာနဲ့ဒီထောက်ပံ့ရေးလမ်းကြောင်းတွေကိုပေါ့နော်အချိန်နဲ့တပြေးညီလှုပ်ဆောင်နိုင်တယ်။တရုတ်အစိုးရအနေနဲ့လည်းဒီဥဆက်ယောဂတွေကိုလက်ခံကူတာတဲ့နေရာမှာတရုတ်ပြည်သူတွေပေါ့နော်ကြီးငယ်မရွေးလက်ခံကူတာပေးတယ်။ဒီပြည်သူတွေရဲ့လုံးကလည်းဒီကျန်းမာရေးဆိုင်ရာအာမခံတွေရှိတယ်။ဒီကုသခံရတဲ့တရုတ်လူမျိုးတိုင်းကိုအစိုးရဘက်ကစိတ်ကူပေးတဲ့အထူးသဖြင့်ကတော့ဒီတက်ကြီးရွယ်အိုတွေနဲ့ကလေးတွေကိုပေါ့နော်အထူးစောင့်ရှောက်တာပေါ့
With continuous improvement of the situation of epidemic prevention and control in Wuhan, many medical workers who once fought in the front line of the anti-pandemic battle returned home after the fulfillment of their missions. Yet, during the busy May Day holiday season, many of them have chosen to come back to their posts to keep fighting the pandemic.
ဝူဟန်မှာဆိုလို့ရှိရင်အသက်80အထက်ဒီယောဂပျောက်ကင်းသူနှုံးအားဆို80ရာခိုင်နှုန်းကျော်ရှိရလို့သိရတယ်။နောက်ပြီးဒီ COVID-19 ယောဂတွေကိုကုသတဲ့နေရာမှာလည်း AI နည်းပညာနဲ့ယောဂရှာဖွေတာလိုမျိုးပေါ့နော်။ခင်မီစက်ကရိယာတွေကိုအသုံးပြုတယ်။ virus ပိုးကိုတိုက်ဖြတ်တာတို့နောက်ကိုခန့်အားတိုးမြင့်တာတို့နောက်ဒီဟာရတက်ပြအောင်ပေါ့နော်အားပေးတဲ့ဆေးတွေကိုလည်းသုံးဆွဲတယ်။နောက်ပြီးအနောက်တိုင်းဆေးနဲ့ပေါ့နော်တရုတ်တိုင်းဆေးပေါင်းဆက်ကုသတဲ့နေရာမှာလည်းဒီရလက်ကောင်းတွေပေါ့နော်အကျိုးသက်ရောက်မှုတွေရှိတယ်။အခုဆိုရင်လို့ရှိရင်ဒီတရုတ်ပြည်တစ်ပြည်လုံးပြည်နယ်တို့ကိုပိုင်အုပ်ချုပ်ခွင့်ရဒေသတို့နောက်ဗဟိုကနေပြီးတော့ဒီဓာတ်ရိုက်အုပ်ချုပ်တဲ့မြို့ပေါ့နော်32ခုဒီအများပြည်သူကျန်းမာရေးအရေးပေါ်တုံ့ပြန်ဆောင်ရွက်မှုပထမဆင့်ကိုဖျက်သိမ်းလိုက်ပါပြီ။အဓိကကတော့ဒီတရုတ်ဆိုရကပေါ့နော်ယောဂရှိသူတွေကိုစောစောနဲ့မြန်မြန်ရှာဖွေတယ်။သတင်းပို့တယ်။တီချာခွဲထုတ်တယ်။ဒီကျွမ်းကျင်တဲ့စေဝန်ထမ်းတွေနဲ့ထိထိရောက်ရောက်ကူတာတဲ့ဒီအားကောင်းတဲ့ကျန်းမာရေးစနစ်တွေကြောင့်ပေါ့နော်။ကုသနှုန်းတွေရောကြရခြင်းဖြစ်ပါတယ်ရှင်။
Confirmed COVID-19 cases have exceeded 3.6 million globally, with the death toll surpassing 250,000, and more than 1.1 million patients have recovered. Latest statistics released by Johns Hopkins University showed the number of COVID-19 cases on the Chinese mainland total 82,883, including 1,678 imported cases and 903 asymptomatic patients under medical observation. China's COVID-19 death toll stands at 4,643. The 13th National People's Congress (NPC) will open its third session in Beijing on 22nd May. The U.S. is leading the world in both COVID-19 infections and fatalities, totaling more than 1.2 million and over 71,000 respectively. Russia has reported over 10,000 new cases for 3 days in a row. It is now the 7th most affected country in terms of infections. The UK now has the highest official death toll in Europe. This is Agajo reporting for Myanmar International Radio. That's the report on how strong China's healthcare system is. Stay with us as we bring you more reports on Myanmar Today. Yangon Regional Myanmar Rescue Organization is taking the responsibility for transportation of the COVID-19 positive patients to respective hospitals or medical centers in accordance with the instructions of the responsible professors of the medical professionals from Yangon General Hospital. At the same time, more than 500,000 volunteers of the Myanmar Rescue in respective states and regions are working on rescue works in the wake of COVID-19.
Under the guidance of the Ministry of Health and Sports, the COVID-19 patients are being currently treated at Wibagi Specialist Hospital and South Okalapa Maternity and Child Hospital. As these two hospitals in Yangon are likely to be filled with infected patients, the new victims are intended to be sent to the Pangji Medical Center. Yangon Regional Myanmar Rescue Organization is taking the responsibility for the transportation of the COVID-19 positive patients to respective hospitals or medical center in accordance with the instruction of the responsible professors of the medical professionals from Yangon General Hospital. Dr. Phyothi Ha, Assistant Professor, Department of Emergency Medical Center of Yangon General Hospital, said,
ကျွန်တော်တို့ကလူရဆိုဒီလိုရမောင်းကစားပြီးတော့လူတဲ့ခါမှာကျွန်တော်တို့ဒီပြင်ပစေစမ်းဝန်ထမ်းပေါ်လာကြအကူကြီးတောင်းရတာမျိုးရှိအောင်အဲ့ရကနေစားပြီးဖြစ်တာ။ဟောဆိုကျွန်တော်ဝန်ထမ်းရမထိုင်တဲ့အခါမှာမလုံလောက်တဲ့အခါမှာဒီလူတွေခေါ်တော့ရမယ်။နိုင်ငံတော်ရဲ့အရာဖြစ်သတ်မှတ်ထားတော့ဆိုတော့တရားဝင်အစဉ်ရှိပြီးသားအဖွဲ့အစည်းတွေဖြစ်ကြတယ်။တကယ်လည်းအလုပ်လုပ်နေတဲ့လူဖြစ်ကြတယ်။အတွေ့အကြုံတွေရှိကြတဲ့အခါမှာဒီလူတွေရွေးချယ်ပြီးတော့တောင်းပေးရအောင်နော်
There's an urgent need for the positive patients to be transported to the respective hospitals or medical center. So we have to ask for help from the volunteer team. Myanmar Rescue is also a state licensed volunteer organization and they already have some kind of experience in emergency conditions. So we are cooperate regarding in the case of transportation positive patients. In front of the emergency department's gate in Yangon General Hospital, we are performing thermal scanning with the help of MR volunteers. There are 27 volunteers for the transportation and 60 volunteers for thermal scanning, and they are all assigned alternatively within limited duty period. When the cases are tested, the people want the positive results as few as possible. The situation depends on the public. At the moment, we can say that it can be kept under control. But once the public fails to follow the instructions, the immediate widespread infection can happen possibly.
Usotan, president of Myanmar Rescue Yangon Region, said,
Till now, Myanmar Rescue MR has not transported the positive patients before, but we have already run 3 times as tests. All the required protection equipment for MR volunteers is provided by Yangon General Hospital, and a training to dress and take off the PPEs systematically is also provided by the doctors. Myanmar Rescue has over 800 members and 30 cars for emergency rescue in Yangon region. We have 5 of our own ambulances and the YGH also prepares 5 ambulances as a standby.
Myanmar Rescue is an independent and non-government rescue organization. It has its regional forces in all of the states and regions except Rakhine State. Uso Mentai, Vice President of Myanmar Rescue Yangon Region, said,
ကျွန်တော်တိုင်းတဲ့ပြည်နယ်တွေကျွန်တော်တို့လူအင်အားကျွန်တော်တို့တိုင်းတဲ့ပြည်နယ်တွေကျွန်တော်ပေါင်းမယ်ဆိုရခိုင်တစ်ခုကလွယ်ကျွန်တော်တို့အင်အား9သိန်းကျော်ရှိတယ်
Myanmar Rescue has its regional forces in all of the states and regions except Rakhine State. Yangon Regional Myanmar Rescue is working with the Yangon General Hospital to provide ambulance services in the wake of COVID-19. At the same time, more than 500,000 volunteers of Myanmar Rescue in respective states and divisions are working on rescue works in the wake of COVID-19.
This is news reporting from MR Radio. I am Phyothi Ritu.
That's the report on Yangon Regional Myanmar Rescue Organization taking responsibility for COVID-19 victim transport in most parts across the country. The Ministry of Labor, Immigration and Population released an announcement including the list of the businesses and services that are allowed to resume operation after being checked by the official inspection teams. Although some industries have already continued operation, some are facing difficulties to operate again, especially the hotel industry. Despite being included in the list, is not yet ready to start operation at present.
To contain the spread of COVID-19, the precautionary measures are still in effect till 15 May, and the Ministry of Health and Sports issued directives and guidelines for factories and businesses to open in the course of the spread of the virus. After the holidays of Tianjian on 19 April, the Ministry of Labor, Immigration and Population already announced that factories and businesses can resume operation only after being checked by the inspection teams led by the Ministry of Health and Sports, including experts. For further processes, the Ministry of Labor, Immigration and Population released a new announcement on 3rd May stating about 21 businesses and services which can reoperate with the approval of inspection teams because of being categorized as essential for the public during the pandemic. State-owned factories, workshops, and businesses, water distribution, electricity and fuel production and distribution, firefighting services, private hospitals, clinics, and health services, and communication, information, and technological services are assumed as essential businesses. Transportation, warehouses, and wholesale centers, ports, cargo transportation and logistics, import, export, and trade services, municipal development services, banking and financial services, insurance companies and companies without goods production, job agencies, information services, toll gates, road and bridge toll collection services, and hotels, motels, and accommodation services can remain open since they are the public services. Printing and publishing services, mineral and natural resources services, chemical-based services, construction services, and fish and prawn breeding, catching, and freezing services can continue operation, being accounted as essential public services. Through a phone interview, U Kin-han, chairman of Baiyana Wholesale Market, talked about the current situation of wholesale centers in Baiyana Market.
We
have closed the market during Tianjian holidays but started resuming operations since 20 April after the holidays. The wholesale centers in the market are keeping up the trade with the consumers through brokers. The staffs are divided into two groups to work on the duty shifts. More freight trucks are entering during these days. Usually there are 1,000 trucks carrying the goods, but now we have about 700 trucks recently. The number is higher than that of the previous period of the virus crisis. At first, we have left only 2 gates opened, and now because of the increasing number of trucks, we are to open 3 more gates, and gradually we will open all gates. For ensuring the health safety of the workers here, we check their temperature, instruct them to wash hands and wear masks.
Hotel industry, which is the most affected since the early stage of the crisis, is facing continuous losses because it has to continue maintenance work without income. There are costs of the expenses for maintenance and staff fees, but there is almost zero number of guests from home and abroad. Although the ministry allows hotels to reoperate, Unang, chairman of Union of Myanmar Travel Association, said the hotel industry is not yet ready to resume operation.
I suggest that hotel industry is not yet ready to resume operation. There are 2 types of guests for hotel industry, local and international guests. The hotels have to place much reliance on the arrival of the international guests, and number of international travelers is coming down to nearly zero. For other hotels which depend on the local guests, there are no more local guests coming to the hotels because of the travel restrictions between the cities of Myanmar and because of the situation of being put into quarantine when traveling from one place to other. If local travel restrictions and semi-lockdown in some areas are eased because of the stable situation of virus spread, we will gradually receive the local guests first. But now it is impossible to resume operation yet.
All these 21 businesses and services are able to continue to open by observing the Ministry of Health and Sports directives on COVID-19 protections and containment processes. It is also mentioned in the announcement that evidence of having proper health safety guidelines should be prepared for the inspection teams. That's all for now. This is Dora Suizin from MI Radio.
And that's all we have for today's reports, and it's time to check on some international news here on Myanmar Today. Xi Jinping, General Secretary of the Communist Party of China Central Committee, has called for efforts to consolidate the achievements in the prevention and control of the COVID-19 outbreak in central China's Hubei province, which was the hardest hit region in the country. He said the CPC Central Committee will continue to send expert teams to the province. They will help the follow-up work on local epidemic prevention and control, guide patient treatment, and conduct psychological counseling. Xi Jinping also called for accelerating the implementation of the supportive policies to Hubei and the overall resumption of daily life. He pointed out the country should learn from Hubei's prevention and control measures and improve the epidemic monitoring and early warning capabilities. Chinese Foreign Ministry said Wednesday that the U.S. should stop thinking it can use tariffs as a weapon to coerce other countries. That's after U.S. President Donald Trump threatened new tariffs last week, blaming Beijing for the coronavirus crisis. Spokeswoman Hua Chunying said accusations that China deliberately spread the virus are baseless. She urged the U.S. to stop shifting its responsibilities. Hua also said that China will expand funding to support the United Nations initiative to speed up the development of vaccines and treatment for COVID-19. Russia has recorded more than 10,000 new COVID-19 cases for the fourth day in a row. It brought the total number of infections to nearly 166,000. The death toll is more than 1,500. More than half of the cases and deaths are reported in Moscow. And that's all we have for today. Thanks for joining me on Myanmar Today. I am Aga Jo. Have a great day, everyone. Stay home, stay safe, practice good personal hygiene, and follow instructions strictly, and always be on high alert for important news. I'll see you again. Goodbye.